Hey, welcome back to the Ready State. One of the things we're noticing in the comments and getting a lot of questions about is, man, fitting the bike, making myself work or fitting the body to the machine more effectively. What we've seen in the shelter in place is that people are spending a lot more time on the trainer, and certainly with the advent of Peloton and Swift and all these incredible at-home training models, a lot of people are doing indoor cycling. Of course, it's been around for a minute, right? So one of the things that I want to talk about today is having more movement choice on the bike. So a lot of times we go get a bike fit and we think is, oh, that bike up and down 1 millimeter makes a difference in your power. But what we realize is that a lot of people are missing huge ranges of motion in their hips. And this, as a starting place to make your body have more movement choice and to be more efficient on the bike, is an easy place to begin. So one of the things that we have to appreciate is that we have certainly seen, as people have gotten more upright with their gravel bikes and they love to kind of be more comfortable, is one of the reasons we are seeing this change to these upright shapes that people love is that it unloads the hip. And that when I'm eating stem and I'm kind of got myself buried, these positions require a ton of hip flexion, means bringing the knee to the chest. What we want to appreciate is that certainly sometimes it's difficult for us to be long, protecting our breathing mechanisms and our position, especially when we're in a tuck shape. So while it's absolutely the spine can handle these globally flexed positions, when you see people riding and they've dumped their pelvis into this position and they're reversed early on, especially as that knee comes to chest, the knee comes to the chest and pushes the pelvis backwards, what we think is, hey, this is not good or bad. We just think that's not as effective position to generate force into the ground. How do I know? Well, no one ever jumped very high in this shape, right? We just have hip function that isn't very powerful. And what we know is that can't breathe very well in that position, or as well as I can if I can have a better relationship between trunk and hip. So there's a whole host of things that our bodies will compensate with, which we can talk about another time. But what I want to appreciate is that many of us really don't have a lot of choice in terms of the bike setup, where I want to put my pedal, where I want to put my seat, or put my seat in relation to my pedal, how high my stem is, or how low I can get for being aerodynamic. And many of us end up chasing sort of an aerodynamic dream, but it turns out that we just don't have the mechanics to really optimize that position. So if you are finding you get off the bike and your back is cooked, one of the reasons for that potentially is the knee comes up and potentially puts a flexion load in the spine. My body's got to compensate backwards so as iliacus hips to try to manage and create an isometric. So it means my rectus femoris, for example, which is that quadriceps that crosses the knee and the hip, is playing a tug-of-war, simultaneously having to work and move the leg and manage all that force production and help keep the pelvis balanced into a position where it can be stable, off of which we can create huge force. So what you'll see is that people are really uncomfortable and they pop up right away and they're trying to unload. So what do we make of this? How do we know how much hip flexion we have? Well, ideally, we can make a choice about our seat setup because we're in a position that gives us the most wattage and output. But if you're riding and you bring your knee through and there's any resistance in this system, then that's a good indicator that you are primed for improving that hip function position. You may be here, but what happens if you get into your drop? Are you feeling any resistance? And as you come backwards, if you feel like your femur's binding, that couldn't be an issue. Or we can say, hey, do you have your normative baseline hip function that every doctor on the planet agrees with, every physical therapist on the planet agrees with, and we'll even take the conservative ones. So for example, we know that you should have about 120 to 130 degrees of hip flexion. So if you're standing next to the bike, this parallel will be 90. We're easily 90 degrees plus an additional chunk of change that gets you to 120 to 130. And we love this standing one because this looks a little bit like cycling. But if you're coming up here and you're like, wow, I'm really feeling stiff here, that's an indicator that you're just losing a ton of power and wattage on the bike. So let me show you a couple simple ways to improve that. What I've got here is a band attached to the rig. And And I'm going to show you 2 really quick ways to just improve that, right? Because it's a moving target. The first one is appreciate that we're moving and trying to improve flexion. So one of the ways I can do that is have my legs straight, like I'm at the bottom of the pedal stroke, and I can move my pelvis on the leg. So this is me pedaling, and then I'm dropping my torso down, and then all I need to do is just practice bringing my knee to the chest and flexing back and forth. What's happening is that I'm getting a little bit of this band distraction, which helps the hip articulate with the pelvis a little bit more effectively to return that position. So it's an easy way in this long lever, leg straightish, weight-bearing position to just see if I can improve how that hip is articulating. And it's very easy real quick before I jump on the bike to be pushing and pulling and just spend a couple minutes finding these raise and positions. And if I just, again, try to get my knee onto my chest like I'm in drops in this position, I can actually put a fair amount of load into the band because the hip is so robust, and then just noodle around. And a couple minutes should lead you into a position of more effortless knee flexion, which again gives you more choices for stabilization, for power. Wonder why some people love to sit and some people have to stand? This is part of it, right? Is that they've adopted positions that allow them to generate more force, and they love to stand up because the hip's open and finally they can get after it. Another way of getting in there is a little bit of short lever position. So now I can be just doing my kind of press backs. The band is distracting to the back, and then I can wobble into a shorter lever position, like the knee is coming to the chest at the top of the stroke, and I can really close this down without sort of the demands of the connective tissue potentially being a limiter. I can even change the direction and have this posterior distraction turn into a little lateral distraction, which gives me potentially more room in the capsule to restore how this is moving. And again, all I'm doing is just bringing my chest to the ground. There are some more nuances in this position and wobbling around, but I'm trying to improve the flexion in this shape. The idea here is when you begin to have some movement minimums, right? What's a movement minimum? Well, we think you should be able to squat, hip crease below the knee, whoop pretty effortlessly without having to come onto your toes or back. This shouldn't be limiting in terms of your ankles. Feet should be straight, just like I'm on the bike in a drop position. And if you're struggling for this position, one of the ways that we can improve that shape is to improve your hip flexion. We want to get better at translating and transferring the specific shapes and positions and coordination that we're developing in the gym to expressions of power and wattage on the bike. How do I know if this worked? My shape's better. Why does that matter? Because I can generate more wattage. So as we kind of continue to work through this should never be about pain, no pain. It should be about wattage, more wattage, less wattage. Do I have more movement choices? Can I set up my bike for a little bit more aggressive power, aerodynamic position? Or do I have to set up my bike to reflect the realities, that the fact that my body doesn't fit the bike? And I make a bunch of trade-offs in force production in the long haul. Simple ways: improve your flexion, improve your cycling.